it's the Dr. White, and I'm back at the Dr. Whiteboard, and we're talking about macular degeneration. And we've moved all the way from 101 and 102, and 201 and 202. We're in graduate studies now, macular degeneration 301, the treatment of wet macular degeneration. Quick history lesson. We used to treat macular degeneration with laser. We could destroy those blood vessels with a heat laser, but every time we did, we would have collateral damage. There would be damage to normal structures, and you'd get a blind spot. The goal was to make the blind spot as small as possible. It turns out that those blood vessels, which are coming through the RPE into the retina, are prompted by factors that promote blood vessel growth, even if it's abnormal blood vessels. And we can make them shrivel up and essentially die if we put an anti-vasoproliferative factor, say that 10 times fast, anti-vasoproliferative factor into the eye. So when we have bleeding, wet macular degeneration, we need to make the bleeding go away as fast as possible. What we do is something called anti-VEGF treatment, where we are injecting factors that will prevent the growth of the abnormal blood vessels. And we actually inject them right into the eye. Very, very tiny amounts of this material are injected into the big central cavity where the vitreous jelly lies. It then diffuses back and it causes those blood vessels to shrivel up. Now there are two medicines that are used. There's one called Avastin, which was originally developed for use with large tumors like colon cancer, and then a newer one called Lucentis. Lucentis actually is a downstream product in the eye of a medicine very like Avastin. Most of the time the retinal doctors will start with Avastin because it works very well and it's much less expensive. But if the Avastin doesn't work, or if there are certain characteristics of the bleeding, they might go right to Lucentis. A series of injections is used, typically at least 3, and then they reevaluate. Sometimes additional injections are necessary on an ongoing basis to keep that bleeding from recurring, and if it comes back, additional injections can be given. It's incredibly safe, and it's unbelievably effective, and now we're not talking about limiting the blind spot, we're talking about saving and improving the vision. Many people regain the same vision they had before the bleeding, 20/20, 20/25, whatever it was. This is one of the true modern miracles in medicine and in eye care. So, I'm the Dr. White. Macular Degeneration 301, the treatment of wet macular degeneration through the injection of medicines like Avastin and Lucentis to cause those blood vessels to shrivel up. I'll see you again.